Bismillahirrahmanirrahim. Assalamu alaikum everyone. So today's we are going to start part 2 of this book. मैंने आपको 100 MCQs करवा दिए हैं and today's we are going to start from MCQs 111. ठीक है. So जो part 1 था वो 110 MCQs पे ख़त्म हुआ है. ठीक है. और उसमें ये है कि थोड़ा टाइम ज़्यादा कंज्यूम हुआ है क्योंकि मैंने वो आपको डिटेल में MCQs बताए हैं विद एक्सप्लेनेशन. अब जो पार्ट 2 है उसमें ये है कि मुझे बहुत सी रिक्वेस्ट आई हैं कि आपने जो है MCQs हमें ज़रा जल्दी वाइंड अप करवाएं, हमें बुक जल्दी कंप्लीट करवाएं. सो इस वजह से अब मैं आपको सिर्फ ऑप्शंस जो हैं वो बताऊंगी. ठीक है, ताकि जो है हम जल्दी से बुक को वाइंड अप कर सकें और कंप्लीट कर लें इंशाल्लाह. सो लेट्स स्टार्ट. MCQs नंबर 111 इज़ inability to perform rapid alternating movements in cerebellar lesion is known as dysdiadochokinesia. Option B is correct. MCQs number 112 is a patient with latissimus dorsi and lower trapezius weakness would have the most difficulty performing which of the following activities? So option B is correct. Modify 2-point gait with a straight cane. This is the most difficult activity they can perform. MCQs 113 is a therapist completes a manual muscle test on the right lower trapezius muscle. In order to properly assess the muscle, the therapist should position the patient in prone. Option B is right. Okay. MCQs 114 is which test is carried out for testing the hip deformity caused by iliotibial band? Option B is correct. Auber test. MCQs 115 is a physical therapist from a home care agency examine a 50-year-old patient diagnosed with chronic bronchitis. The patient is overweight and present with cyanosis at the fingertips and shallow breathing. The most immediate goal would be to implement breathing exercises and postural drainage technique. Option B is correct. MCQs 116 is the approximate half value depth of penetration of microwave is. Option C is correct, 3 cm. MCQs 117 is a patient is referred to physical therapy 24 hours after a total knee replacement. What exercise would be the most appropriate to begin treatment? Quadriceps sets. ठीक है, ऑप्शन ए इज़ करेक्ट. MCQs 118 is the two meridians that do not have any element associated with them are the conception and governing. Option D is correct. MCQs 119 is a physical therapist is seeing a patient who is lacking terminal right elbow range of motion. What type of orthosis is appropriate for this patient? Option D is correct. Corrective orthosis is appropriate for this patient. Okay. MCQs 120 is which progressive resistive exercise would function to strengthen the infraspinatus and teres minor? Option C is correct. Lateral rotation of the shoulder with elastic tubing. MCQs 121 is the diaphragm contracts on inspiration. Option A is right. MCQs 122 is renal calculi are C. Option is right, kidney stones. MCQs 123 is in rheumatic arthritis the pathology starts in synovial. Option B is correct. MCQs 124 is intrinsic tightness is characterized by increased IP joint flexion with MCP joint flexion than that with MCP joint extension. Option B is correct. MCQs 125 is you are a physical therapist working in private practice and in charge of marketing a New York conditioning program to public and physicians. You are on a fixed budget and must determine the appropriate marketing media for you to utilize. Which of the following would gain the most access to the public and maintain cost control? ठीक है, जो कॉस्ट कंट्रोल हो, हमें एक्सपेंसिव नहीं पड़े और हर ऑडियंस तक आसानी से पहुंच भी जाए. सो ऑप्शन सी इज़ करेक्ट, न्यूज़पेपर एडवर्टाइजमेंट. ठीक है, बिकॉज ये रीज़नेबल भी होती है, बहुत एक्सपेंसिव नहीं होती है. ऑप्शन सी इज़ करेक्ट. MCQs 126 is cancer is a disease that can be spread through the lymphatics and blood system. Option B is correct. MCQs 127 is a patient presents to physical therapy with a complaint of pain in the L5 to S1 are with no radicular symptoms. Palpation and range of motion assessments of the patient of the lower lumbar spine do not reproduce any other patient symptoms. Which other musculoskeletal structure can refer pain to the lumbar spine? Option A is correct, T12 disc, because जो nerve root involvement है would refer pain only to the lower, would refer pain also to the lower extremities, and facet pain is very localized.